Welcome back to Talk of the Town. Right now my guest is Eric Hewitt, who is a doctor of pharmacy and the owner of the medicine shop in Verona. Eric, welcome to the program.
Thanks for having me.
Good to have you back. We're going to be talking about a pretty important topic today, immunizations, and I'm wondering if you can talk to us a little bit about why it's so important to have to get ourselves immunized,
Sure.
Not just when we're kids, but even now as we continue in our adult life.
Absolutely. There's a couple of things. Number one, over the last century, I think if you talk to just about any medical professional, they'll tell you one of the greatest advancements in medicine has been vaccinations. We've basically eradicated or eliminated very deadly diseases such as smallpox. Up until recently, in the United States, measles wasn't an issue for young kids. So you have those types of diseases that you don't have to worry about that were very deadly that you can prevent. And as you get older, sometimes those immunizations do wear out a little bit, and you need to give boosters to re-up the immune system to be able to fight that should you get exposed to them. Yeah,
and can you talk to us a little bit about those boosters and how we know as adults what immunizations or boosters we're due for, after we've gotten all the basics when we were the kids?
And I think that's a great question, because I think a lot of people are sitting maybe at home and say, I don't know when the last time I did get, a shot for this or that. In fact, I was in the doctor this week and they said it was time for me to get a booster. And so there's a couple of ways you can do that. Number one is a regular doctor visit. As healthcare professionals, I'm always going to recommend that you maintain an active relationship with your physician. And a lot of times they'll go through that as part of a patient visit. It pops up onto their software and say, hey, he's due for, this immunization or that immunization. Are you, interested in getting that today? The other place that can do it is, believe it or not, a pharmacy. Myself and a staff pharmacist at the medicine shop in Monona are certified to give immunizations. And the state has a statewide database that all immunizations that are given are put on a registry. So I can look up your immunization history and you come in and I can say, it's been a while since we've done this one, you're due for this. Or I don't see that you've gotten a flu shot this year. Maybe we should think about getting those types of things. So the doctor's office and even many pharmacies now that do immunizations are able to tell you that information.
Yes, and the immunization registry, that'll be available to my physician when I go in, and he'll be able to tell that I went to the medicine shop to get an immunization.
Absolutely. Every immunization that we do, we upload that information on there, and they're able to do that. Now, sometimes that doesn't necessarily, talk with their system in-house, but they are able to go on there. They upload that same information to the same registry, so when they do that, they are able to see that kind of stuff. Absolutely.
Yes, good, great. People have talked about some of the risks, potential risks associated with immunizations. Can you talk to us a little bit about what, if any, risks there are associated with getting immunized?
Anytime you get a medication, put something into your body, there's always the potential for an adverse reaction. But by and large, with immunizations, there's really very minor side effects. Things like pain in the injection site, maybe a mild headache or something like that. But the major things, like there's been rumors out there over the last couple of years about them being linked to autism, other major psychiatric or physical impairments have really been debunked in the medical journal. And actually the first person that came out and had the information that put an article out there about the link to autism has even retracted his statements, and that's really been proven incorrect.
Yeah, okay, thank you for that information. Can you talk to us a little bit about both where are the best places to get immunized, get immunization shots, and also if people couldn't afford to pay for them, where they can go to get free immunization?
Sure. As children especially, there is a program in the state of Wisconsin called Vaccines for Children. So if somebody does not have adequate coverage under their health insurance for those vaccines, maybe if they're don't have the income and have medical assistance or something like that, there's a program in the state of Wisconsin that provides those immunizations for free. Where you can get those immunizations free or just covered through your health insurance is obviously the doctor's office. That's the thing people think most of. But one of the things I wanted to bring up today is that most pharmacies these days are able to give immunizations. Like I said, myself and one of my staff pharmacists give immunizations at the medicine shop in Monona. And so oftentimes your pharmacist can be the one to give you the immunizations. I would just have people check with their insurance to make sure of the coverage before they go ahead and get the vaccine.
Absolutely. Eric Hewitt, owner of the Medicine Shop in Monona, thank you so much for the information today.
Thanks again for having me.
And that's all the time we have for Talk of the Town. We'll see you next time.